Some of the major causes of sprains and sprains are athletic events, and depending upon what sport or activity an athlete is participating in will determine the type of injury or sprain or strain he may have. For instance, in overhead athletes, we may have shoulder sprains or strains from overuse, or an acute injury such as a fall or traumatic event. In the case of athletes that may be participating in things like soccer or football, we may have a sprain or strain to the knee. That could be something as common as an ACL injury, where athletes will sprain their ACL and at times can end up with a complete tear, which then requires surgical intervention. So those are some common injuries in the knee. Others may be MCL, or medial collateral ligament sprain. That's a ligament that supports the inside of the knee, and often that can just be treated with bracing as opposed to surgery. When we talk about areas of around the ankle, we talk about basketball players and soccer players that can have injuries to the ligaments around that region. Basketball players recently have been found to have higher rates of sprains, but bracing seems to prevent more serious sprains. So now we're talking about actually bracing basketball players in order to decrease the incidence. For years, people have talked about wearing high-top shoes and different type of athletic supports to prevent injuries. We now have some studies to support the wearing of braces to decrease the injuries to ankles. One of the more severe sprains that can happen in the foot is something called a Lisfranc sprain, and that can happen in football players, in which another lineman may roll up on another athlete, and that is something that is an emergency that can require surgery. So if a sprain in the foot is not improving with rest, ice, then they should be evaluated because it may actually require surgical intervention. Strains and sprains can be prevented by actually bracing at times when we talk about basketball players and wearing braces around the ankle. If you are aware of the turf or grass you're playing on, sometimes we'll adjust your footwear accordingly, and so that can decrease the incidence. The other things that you can do are condition yourself, certainly being prepared to participate in whatever athletic event that is. If you're a throwing athlete, it may mean warming up your shoulder before throwing, not going out and just throwing fastballs immediately, but actually throwing light toss and then going to an extended distance and then building up the speed. So adequate warm-up is important, and especially for all athletes, pitchers, throwing athletes included, doing a light jog. If you get a strained muscle, certainly rest is an important part of the healing process. Ice, usually for 20 minutes, sometimes ice packs or frozen peas or corn work well to decrease inflammation. Anti-inflammatories over the counter, if you're not allergic to those, can be helpful as well. And then therapy at times can be helpful to get you back in your game.